Good evening, everyone. My name is Nalisha, and I will be doing a teaching presentation on fall prevention. I will be talking to you specifically about the falls risk assessment called the Hendrick 2 Falls Risk Model. The handouts that I've given to you basically has information about the validity and reliability of this tool. Why focus on preventing falls? 30% of inpatient falls result in serious injury and even death sometimes. Preventing falls increases patient trust, it improves care, it improves overall patient satisfaction, it decreases unnecessary costs for the facility and also for the patients. Why should we focus on preventing falls? According to evidence-based research, out of all patient incidents such as medication errors, pressure ulcers, hospital-acquired pneumonia or infections, and estimated 84% was due towards patient falls. What can I do to prevent falls? This should be the question for, this should be the questions many of us should be asking ourselves. Leadership and frontline staff involvement should definitely be involved. Identify fall and injury risk patients is also important. Patient-family engagement is also necessary as well. And if we're going to implement a fall risk model, definitely monitoring the performance of that model is key. How do we identify who are at higher risk for falling and injuring themselves in the facility? Evidence has proven that using a falls risk assessment tool to screen all patients, we are now able to identify those patients who may be at a higher risk for fall. The Hendrick 2 Falls Risk Model allows implementation of appropriate intervention and a follow plan. We're also able to notify all pertinent healthcare staff of that resident fall risk. It also highlights key risk concern for each resident. It reduces potential for serious harm or even death from a fall. Is it really that important to do a falls risk model or assessment tool? Patients usually don't know that they are at a higher risk for falls. So it's definitely necessary for us to implement this tool. They also may not realize that it is important to tell you that they have fallen 3 times in the past month or that they are making frequent trips to the bathroom. So this is how the falls risk assessment can come into play if we really think about it. Patients and families may not understand why medication made them a risk for falls. Using a risk assessment tool can help draw this information out of patients and pretty much help prevent falls. When and how often do we need to administer this falls risk assessment? Initial falls risk upon admission, reassess with patient condition or medication change, at shift change and patient rounds. And initial ongoing fall risk assessment are both important. So the brochure that I handed to you, if you turn to the section that says reflection, it basically gives you a brief synopsis of what the falls risk assessment is about. It can be administered very quickly, so pretty much if we assess the patient, it's not like a 5-minute assessment. It's just a minute. It takes just 1 minute. And also, if you look to the back where it says there's a did you know factor that is in the ending, it says it is based on gender. Pause.
No.
Okay, so in the brochure that you have, there's a section that talks about the validity and reliability of this model. There's also an implementation section as well, and there's also a reflection and a did you know factor as well. So this tool overall, it screams for primary prevention of falls and is integral in the post-fall assessment for preventing secondary falls. So I hope you have learned something from my presentation. Thank you for your time. And if you have any questions, feel free to ask. But now we're going to do like a role demonstration using this falls risk assessment. Thank you.